Let's talk about treatment options for acute injuries such as an acute ankle sprain or acute lower back pain. Maybe you're afraid treatment in the beginning will be painful, or maybe you're worried it will be unsafe. Or you just might not even be aware that there are options for acute injuries such as an acute ankle sprain or acute lower back pain. Chiropractic care is both appropriate, safe, and beneficial for acute injuries, even in the very beginning stages when they're swollen and painful and movement is really limited. Chiropractic care can help improve circulation and reduce inflammation, reduce pain, and help you learn what you can do at home to help your injury heal. In the beginning phases of care, when the injury is still swollen or there's still a lot of muscle spasm and a lot of pain, care is going to be modified based on where your pain levels are at and where the injury is at in its healing process. Beginning phases of care can include passive modalities such as ultrasound, scraping or instrument-assisted soft tissue work, lymph drainage, and kinesiotaping. Ultrasound is a deep heat through sound waves that helps move the fluid out of the area. It can get deep into the joint and deep into the deeper muscles of the back. So this can help move fluid inside the joint of the ankle or move fluid that's deep in the lower back in those deep stabilizing muscles. Lymphatic drainage or scraping can be done lightly in the beginning when there's a lot of pain and still some swelling to help move the inflammation out of the injured area, such as the ankle, being really far away from the heart sometimes. And when you're standing, gravity is going to pull all the fluid down into the foot and ankle. So the lymph drainage with gentle scraping can be really helpful to help kind of encourage the reduction in inflammation, and that can help with pain. This can also be done on an acute low back. Again, gentle scraping can be modified and can help reduce pain and inflammation. Kinesiotape can be helpful for support of the area, either the lower back, of the ankle. This can help with things that you may need to do during your day, such as work duties, house duties, and this can help give a little extra support and help with pain in the beginning. Once you're able to move the injured area a little bit, in-office care can go over what the appropriate movements and exercises would be so that you can do home care to help reduce your pain, improve your function, and heal your injury. Here are some examples of some exercises and things you can do at home for your acute injury. When you're suffering from lower back pain, you want to gently assess your ability to move your lower back. You can take your back through different ranges of motion to see what you can tolerate and then determine if you have a preference for a direction of movement that might help you reduce your pain. You want to gently move into each direction, forward, backward, and then to each side, trying to assess when in the movement you have pain, and then try to move repetitively just below the amount of movement that creates pain to see if you can improve your pain through a set of 10 repetitions. If your lower back is painful with movement, you can get into this 90-90 position for relief of your lower back pain. This position can reduce pressure on the lower back. You want to be on your back with your legs propped up, your hips flexed to 90 degrees, and your knees resting on a surface. You can lay in this position to get some relief from the pain. You can also gently pull one knee in towards your chest, pull the other knee in, and even pull both knees into the chest. The knee to chest position without propping the legs up can also reduce pressure on the lower back. And from here, you can gently pull the knees into the chest in a gentle rocking motion, or you can just hold the position by itself. You can try gently rocking your legs back and forth in a windmill-like movement to see if you can tolerate rotating your legs to get some gentle rotation, mobilization into the lower back to see if that can help relieve any of your pain. Pelvic tilts are a great way to get gentle range of motion of the lower back, by rocking your pelvis back and forth while also gently engaging your core to support your lower back. Once you can perform the pelvic tilts without pain, you can progress into the glute bridge by zippering your pubic bone towards your sternum, creating a flattened position of the mid-back and engaging your core, and then slowly rolling through your pelvis, engaging your hamstrings and glutes, pushing through your feet to lift your hips off the floor, only as high as is comfortable. You only want to move into an amount of glute bridge that does not create lower back pain. And then you can perform this as a repetition if tolerated. The dead bug exercise is a great way to engage your core and work on some movement without moving your lower back when you have low back pain. You want to lay on your back and stabilize through your mid-back, engaging your core, lifting your legs up, and then lifting your arms up. And at each phase of the movement, make sure that you have no low back pain and see if you can move opposite arm and opposite leg away from each other, alternating one pair at a time, and only move as much as you can without any lower back pain. If you can do this without pain, it can help reduce your lower back pain. You can also add additional modified movements by pressing one knee into one hand, alternating back and forth to see if this can help create less low back pain. With lower back pain, it's important to know how to get up from the floor without increasing your pain. You can gently lower the legs down to the floor to help get yourself into a side lying position, pushing up through the lower elbow and your upper hand, and then trying to get into a kneeling position. Then you can come up, move the top leg, and try to push through the lunge position into a standing position. I hope these exercises gave you some ideas of how you can help manage your acute injury at home. Let me know if you have any questions. Until next time.